We're hearing tonight from the family of a personal support worker who died this week after contracting COVID-19. Arlene Reid worked with the Victorian Order of Nurses in Ontario's Peel region, and her death comes as another long-term care home operator in the province is facing a lawsuit. Lisa Shing has those details.
Days after her death, Arlene Reid's children are still reeling.
She was phenomenal. She was amazing.
In all aspects, like her smile lit up a room, her laugh, she was vibrant.
She treated everybody like her own kid.
The 51-year-old died at home over the weekend, the second personal support worker in the province known to have died from COVID-19. Reid was a home care worker and employed at long-term care homes in Peel region.
Seeing my mom deteriorate in such a short period of time, it's an experience that I can't explain. And I'm just trying to figure out, where do I go from here and how do I live without my mom?
In Kitchener-Waterloo, Tracy Rowley is also mourning the death of who she calls her second mom. Shirley Eggerty never married nor had children. This photo of Tracy hung in Shirley's room to remind her to be positive.
She called me her daughter. We would exchange Mother's Day gifts and cards that I would to her, and Christmas gifts.
Eggerty tested positive for COVID-19 in early April. She died last week. Today, Rowley signed on to this class action lawsuit against Rivera, the company that runs the home where Eggerty lived, citing negligent care.
I didn't get to see her again. I didn't get to hug her and say how much I love you and how special you are. I don't want any other person to lose a mother, a father, a friend. This isn't the way they deserve to go out.
The lack of management oversight, the lack of training of staff, the underpayment of staff, the understaffing of homes, the profit over what I call the profit over the person motive of these long-term care operators has existed for years and years.
Rivera says it's reviewing the matter and will respond in an appropriate way at the right time, and it'll continue its efforts in caring for residents. Over the past week, the number of deaths in long-term care homes in Ontario has steadily increased from 516 to 835, a 62% jump. In Ontario, long-term care residents make up about 77% of all COVID deaths, higher than the 68% in all of Canada.
No matter if it's transferring staff from the hospitals or bringing in the military, it's all hands on deck.
But some unions are calling on the government to take over managing the homes, like in other provinces, including British Columbia. Lisa Shing, CBC News, Toronto.